Watch this before getting any injections for your knee pain. There's three main categories of knee injections. It's really important that you understand what each one is, what it's good for, and what they're not good for. The three main types are steroid injections, hyaluronic or gel injections, and the number three is going to be a regenerative or a tissue type injection. And this includes things like plasma, platelet-rich plasma, and stem cells. So before we get into that, first a quick primer on what is happening in osteoarthritis in your knee. So your knee is made up of a couple of structures. You have the femur, tibia, fibula, and then you have a patella or kneecap, and then all the supporting tendons and ligaments surrounding them. Most commonly, knee from osteoarthritis is caused by the wearing down of both the meniscus, which is in the middle, and the cartilage that's covering the bone. And it ranges based on the stage that you're in. So cracks and fissures form in the cartilage and cause pain, and that changes your walking patterns, which also leads to hip, back, and even neck pain in the long term. So what are your options in terms of injections? Number one is going to be the steroid injections. This is the most common type. It's the most commonly prescribed, and it's most commonly known as a cortisone injection, but there's a lot of different names for it. This is by far the most commonly prescribed because it has the ability to almost instantly relieve pain, and it stops the inflammatory process in the knee. And probably because your doctor wants to get you out of pain pretty quick because you're there in a lot of pain. So the problem is that they've been known for a long time to cause some damage. So the research has shown that with corticosteroid injections, there is damage to the native cartilage stem cells. Your cartilage has stem cells to help reproduce itself. This damages that. It also increases the risk of cartilage destruction. There's no long-term pain relief in chronic pain sufferers, and it's not recommended before surgery as it increases post-surgical infection risk. Steroid injections may lead or hasten the need for total hip or knee replacement. The next type of injection is called visco supplementation or gel injections. The idea behind these is to provide cushion and pain relief along with a broader treatment plan to help you move more often. When it works well, it'll last for 6 to 12 months. You may have heard this treatment go by many names, including Genvisc, Supart, Synvisc, Gelson, Trivisc, Rooster's Comb, and there's several more. They're all basically the same thing, mostly varying on dosage schedule and the atomic weight of it. But they're all designed to give you more viscosity in the knee so that you can move and bend and do the things that you like to do. The last are regenerative type injections. This can be classified as platelet-rich plasma or stem cell injections. Platelet-rich plasma is a process where your blood is drawn, spun in a centrifuge, and the platelet-rich plasma is drawn and put into the joint. So the pros and the cons. The pros is that it's significantly better long-term pain and functional improvements when compared with hyaluronic acid injections and steroid injections. The results tend to get better over time as opposed to a steroid injection that wear off over time. Some studies show that hyaluronic acid or gel injections and PRP work well together, and there's some that state that PRP is just superior. The cons are a few. The main one I would suggest is that you tend to need more than one injection. Studies have shown that at least 3 to 4 show significant differences than just one alone, and it takes a little while for it to work. The last type of injection is the stem cell. There's a lot of controversy over this one because it's just misunderstood. The pros is that with these injections, in the research, up to 77% of patients reduced or eliminated their pain medications. Very cool. The second study showed significant improvements in all patients treated with better results in earlier cases of knee osteoarthritis, with maximum results at 6 months after injection. Another pro is that this therapy is very safe. We haven't seen any side effects, and in the research, there hasn't been any side effects. In another study, results seem to improve more with the combination of PRP and stem cells. The cons is that, like PRP, there really aren't that many negatives. It's important to understand that all of these treatments are reliant on a healthy lifestyle, weight management, diet, exercise, and so on to work to their maximum potential. If there is no magical cure or magic pill that's just going to take an osteoarthritic knee and then turn it back, 20, 30, 40 years. But there is a lot of functional improvement and pain relief that can be had, especially when it's combined with a comprehensive approach that's taking care of the strength, the spacing, the flexibility, the stability, and also improving the healing potential that's within the joint itself. Without all of these things, you'll get pain relief, you'll get function back. But if you're doing the same thing over and over again, then you're going to end up with the same result. So it's very important that you take some control over your own health and commit to getting better. So if that helped, then just hit the like and share it with a friend. Thanks.